Hello and welcome to Freedom from Kidney Disease. Ooh. And it's bigger than I thought before. I mean, I've done a lot of research on this and I didn't realize just how significant it is. I know it's important. It's not considered a major leading cause of death like heart disease or cancer, but it's very fascinating because you know what? 1 in 3 people over the age of 65 have chronic kidney disease. And that's rather significant. And people actually don't usually are listed as dying from kidney disease. They usually die from a heart disease or diabetes complications. So it's the things that it's kind of misleading because yeah, people have kidney disease and they got other things too. So it's part of the entire metabolic syndrome of inflammation and vascular disease that we see. And it's rather significant. And it's one of those things that most people don't even know about when they have it. It's kind of sneaky because you don't really know about it until you necessarily go to the doctor and get your blood work done and they work. So there's all kinds of things that can be showing up for kidney disease that you don't even realize. So my first introduction to kidney disease, I always like to start off with a story or two. And so my first introduction to kidney disease was autopsies. Yes, I did autopsies before I went to medical school and I did them for about 1.5 years. And so I got to see firsthand inside of the human body of people who had died from complications of chronic disease. And I got to see how their kidneys actually looked. And it was rather grim because a lot of people who died from heart disease or cancer or other complications, they also had kidney disease. And it was very, very profound to see it. You could see the fat, you could see the nodules, you could see the profound amount of kidney disease that was there. So even though that was not considered the single cause of death, it was part of the picture. It was definitely there. And then years later, it was probably about 10, 11 years ago, I got to help one of my friends and he was on dialysis every day, 13 hours a day. And so we had a chat and we talked about a plant-based diet. And he was skeptical because he had a background in biochemistry and he thought he knew everything. And so anyway, I said, look, I want you to try this out and really see if that can help you because he was struggling with his blood values and his protein spilling and everything else that was going on because he was on dialysis. And so he started a plant-based diet and lo and behold, he improved. And it was rather remarkable. And it actually helped him so much that he was able to be on the list for a kidney transplant, which he eventually did get. And then I had another friend of mine that came to me just a few years ago. I'm going to share the video that I recorded after working with my friend John. And John and I played basketball. We'll be coming back to playing basketball eventually. But John, young man, 42, very, very bright, very brilliant. And anyway, he said, I need to talk to you. I've got some concerns about my health. So we went to lunch and he said, I went to the doctor and the doctor has assessed me as having serious kidney disease. And he said, the doctor said he can't do anything more for me. There's nothing he can do, nothing more that he can do. And this devastated my friend. He says, this can't be the case. There's got to be something that we can do. You know, how has this emerged? So I explained to him at lunch what I'm going to share with you today and then some, but I share with him about how kidney disease is a process of lifestyle. And so we needed to change the lifestyle. And so he agreed to make some changes and started to make the changes. And just within a short period of time, his blood values all improved. His kidney disease actually got to a point where he was considered healthy. Like, wow, how could that be? So it was really remarkable to be able to see that reversal of kidney disease. So it is possible for that to occur. So I've got lots that I'm going to share with you today. Lots. For every single one of my webinars, I do a tremendous amount of research, just so you know. I mean, it takes me hours and hours to compile all this information. And I love doing them because I learn more about the subject, even more so than ever before. So I do not claim in any way, shape, or form to be the all-knowing expert. I'm not that person. No, I'm a student. I've always been one. I always will be. So I'm going to share with you a lot of great information today about kidney disease, and it's really well worth investigating this. If you are able to type in your chat window, what I'd like to be able to do is ask if you are currently following a whole food plant-based diet, please type in the number 1 in the chat window for me. Go ahead and do that. If you are following a whole food plant-based diet currently, go ahead and type in a number 1. That's great. All right. So if you're doing that, if you are not following a whole food plant-based diet and you haven't been for, so type in a number 2. And if you are curious and you're experimenting or you're really wanting to see about following a whole food plant-based diet, type in a 1.5. All right, so either a 1, 1.5, or a 2. So go ahead and type in those numbers. So very, very good to see. All right, got a lot of 1s here. All right, very good. Okay, really, really great to see. All right, we're going to go to work now on talking about kidney disease. So let me switch over to my PowerPoint slide. And just to let you know, if you're new, and by the way, if you've never been in one of my seminars or webinars, go ahead and type in new, because I'd like to acknowledge that and just get to know that you are new to listening to me. So I think most of the people here, I see familiar names. All right, but if you're new, go ahead and please do that and type that in. All right, so really great. Let me switch over to the PowerPoint. Take me a moment here to just do my clicks. All right, so I'm going to go over here and click here and click and click and click and click and click. All right, really great. So now I've done all the clicks. Okay, so we've got lots of material to go over. So freedom from kidney disease, and most of you know me, but I'm just going to do a short intro of my story. So my name, Ruben J. Guzman, MPH, does not stand for the speed that I drive my car. All right, it stands for Masters in Public Health, and I got that degree from UCLA back in 1988. In fact, my full education, I thought I'd share with you. So I did my undergraduate training and education, my bachelor's in biological sciences from California Lutheran University in beautiful Thousand Oaks. And then I did a couple of years working in the hospital at the Los Robles Regional Medical Center while I studied to go to medical school at UC Davis School of Medicine. Spent 3 years there, split my second-year curriculum to do research, and my research led me into the field of public health. My advisor said, Ruben, you're onto something here, but quite frankly, we do not have the resources for you. So as a result, I then went to UCLA to the School of Public Health, loved my program. I specialized in behavioral sciences and health promotion and health education. And when I got done with that in 1988, I had a very important decision to make. Do I or do I not go back to UC Davis School of Medicine to complete my training to become a physician? I realized at that point that I was passionate about promoting disease and preventing disease and promoting health. And I was no longer committed to treating a disease. So as a result, I made a bold decision. I chose at that point to not go back to medical school, but to study lifestyle medicine on my own. That's what I was committed to. Now, there was no course of study in lifestyle medicine back then. It didn't exist. I was ahead of my time. So to work and to make money and to make a living, I went into healthcare administration, and I did that for about a little over a dozen years. And I just loved it. But in 2016, I was already a consultant at that point. I went to the Nutrition Healthcare Conference in Anaheim. And at that conference, I discovered that there is a new branch of the American Medical Association. I had no idea. Yes, the American College of Lifestyle Medicine, and an evidence-based approach to prevent, reverse, and treat chronic disease using lifestyle measures as opposed to medications. And guess what? We can do a better job with lifestyle as opposed to medication. And there's a reason for that. So areas of focus in lifestyle medicine include nutrition, physical activity, emotional well-being, alcohol and tobacco reduction, healthy relationships, hydration, and sleep. All of these are spokes of the wheel of our lives. And healthy lives need the spokes to be in balance. I was so thrilled when I discovered this. I signed up right away, went to my first lifestyle medicine conference in October of 2017 in Tucson, Arizona. And at that conference, they announced the opening of board certification, both for physicians, either MDs or DOs, but also for professionals, for those with a PhD or a master's in a health-related field. I was ecstatic. I said, that's me, I'm in. I signed up, I studied for a year. And then in October of 2018, I went to my second lifestyle medicine conference in Indianapolis. And at the end of the conference, I sat and I passed my board exam. So I am one of the first board certified lifestyle medicine professionals in the world. I'm so proud of that. And it's really an outstanding opportunity. I finally found my tribe after 30 years, and it's just extraordinary. People these are all health professionals who are passionate about preventing, reversing, and treating chronic disease using lifestyle instead of medications. And we know we can do a better job. So that's what I love being able to do, empowering people to actually change and transform their lives. In addition to that, I'm also a member of the Institute of Coaching associated with Harvard. I love that. And there's a lot of us who are in lifestyle medicine that are associated with this institute. So I get to live into this quote that Thomas Edison said well over 100 years ago, that the doctor of the future will give no medicine whatsoever, but will instruct his patient in the care of the human frame, in diet, and in the cause and prevention of disease. Doesn't that make sense? That's who we are. We are the doctors of the future. So I am your resident doctor of health. All right, very different from a medical doctor. So I don't prescribe any medications whatsoever. I'm not interested. All right, so just to also let you know that I have absolutely zero, zilch, nada, no conflicts of interest whatsoever. I have no products, I have no gimmicks, no scams, no schemes, none of that whatsoever. I am passionate about eliminating chronic disease from the face of the planet. And I also believe that as adults, each of us has a responsibility to leave this world in better condition than how we found it. It's important for us to leave a legacy for our children and our grandchildren to come. And so for me, I've got 4 boys. I do these webinars and seminars for free to make a contribution to the planet, because I think we all need to be doing that. So that's why I do this. I don't expect anything. I don't ask for anything. It's just my way of giving to all of us. And that's why I do this. So what I do for a living, I'm an executive and business coach. I train CEOs and executives in leadership and in health. And I do work as a lifestyle medicine professional as well. So I do seminars, I do group coaching programs, I do individual coaching programs, I do lifestyle medicine in the workplace as well. So I do programs. So that's what I do for a living. This is for free. This is my passion. So thank you for joining me with me today. And my request is that you share this information widely, because you know what? You could save some lives by the information that we're going to have here today. So that was my request, because I feel that Virgil was correct when he said this over 2,000 years ago, that the greatest wealth that any of us can have truly is our health. And I love what the Dalai Lama says, sobering words. When he was asked what surprised him most about humanity, the Dalai Lama answered, man sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he is so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as if he is never going to die, and then dies having never really lived. Wow. Sobering words for us to think about. So it's really important for us to consider how to fully live. And that's my commitment. And that's the title of my upcoming book, How to Fully Live. So the framework of what we're going to cover for today, I'm going to cover several things. There's a lot to cover. I'm going to talk about the context for health because it's so important and relevant to kidney disease. We're going to talk about kidney function, how to measure it, what are some of the measures that you can get from the doctor's office. We're going to talk also about chronic kidney disease and what the research shows is really at play when it comes to chronic kidney disease. We'll talk also about the research, and there's so much cutting edge recent research that I want to share with you. It's just amazing. And then we'll talk about the six rapid recovery steps. If you have kidney disease, you want to get started with this right away. This is a protocol to absolutely rapidly recover from kidney disease. And then we'll talk about how you can make the rest of your life the best of your life, because just having information is never enough. It's about transformation. How can we transform our life to no kidding, really have the rest of our life be the best of our life? So let's get started. Just to let you know, again, I am a student. I have many teachers. One of my teachers has some words of wisdom to impart to you. You must unlearn what you have learned. All right, so I'm hoping you're willing to listen to the wisdom of Yoda. Now, let's begin with this very sobering concept. So Dr. Stephen Loam, he's a friend of mine. He's a cardiologist in the Chicago area. And he says that there are 5 major factors that keep us as Americans sick. All right, number 1, we've got so much stress. So when we're in the state of stress, our brain is wired to do what it needs to in order to survive. So it's going to seek pleasure, avoid pain, and conserve energy. So those are the things that we do, but that doesn't help us to stay healthy at all. It just means that we're going to survive. Now, another thing that keeps us sick is our family patterns of behaviors. So a lot of people mistakenly think, oh, diabetes runs in my family, I'm doomed to get it. But that's not the case. Now, what we show is that genetics is only responsible a small portion for how the disease could be predisposed for you and predetermined. But the thing is, lifestyle loads the gun, lifestyle pulls the trigger. Genetics loads the gun, lifestyle pulls the trigger. And then the food industry, oh my God. I mean, when you think about it, all right, do you think the Colonel really wants you to be healthy as his number 1 priority? No, that's not the case. All right, so you got to get that. All right, the food industry is interested in one thing and one thing only, your money. And then there's the United States government, and the government at all different levels, because our government is not focused on public health. I can say this firsthand because I was appointed by the Sacramento County Board of Supervisors to sit on the Public Health Advisory Commission. I did that for a couple of years, and it became painfully clear. Government does not put health as a priority where it needs to be. It puts it way down the ladder. Economics and money-making deals are always at the top. And then the other thing that keeps us sick is the medical system itself. And again, I can speak from having been inside the belly of the beast, because the medicine world, the whole medical world is so much entrenched with the pharmaceutical world. It really is. In fact, on the board exam, there's about 60 plus questions related to pharmaceutical drugs. How many questions do you think there was on nutrition? One question on nutrition, that was it. So the thing is, if you think your doctor knows a lot more about nutrition, don't think that at all. That's really a mistake to assume that at all. So what lifestyle medicine is all about is about reversing this. We want to keep us healthy. We recognize this. And lifestyle medicine is the foundation of healthcare because 80% of healthcare is chronic disease. Today it is. And 80% of chronic disease is caused by lifestyle. So if the disease is caused by lifestyle, the foundation ought to be a lifestyle treatment. Doesn't that make sense? It does to me. Dr. Wayne Dysinger is one of the founders of the American College of Lifestyle Medicine. So for us to be able to really address this, we can't just use a quick pill. No, it's not a quick fix. We need to actually build resilience. We need to be able to teach people how to build healthier, stronger, more vibrant lives. This is my friend Nimai Delgado. By the way, he's never had an ounce of meat in his life. So he is absolutely demonstrating severe protein deficiency, don't you think? All right, so resilience is the capacity to prepare for disruptions, recover from shocks and stresses, and adapt and grow from a disruptive experience. So we need to build this resilience. It's very important for us to do that. So we'll do that by understanding the context for our health, the framework for what frames our health, our energy, our vitality. It starts by examining this quote from Dr. Kalitsky, who said this a long time ago when in my undergraduate training. He said, remember that all of life is in one of two states at any given moment. Either it is surviving or it is thriving, and that's all there is. And when he said this, it confused me, and I was befuddled because, I mean, Dr. Kalitsky, are you saying it's just one or the other? And he said, yes, that's what I'm saying. I said, there's got to be a bell-shaped distribution curve or some spectrum here. And he said, no. I said, I don't get it. He said, sit with it, Ruben, you'll figure it out. His famous words that he said to me often. So I sat with it for 3 years, and I couldn't connect the dots until I was in medical school taking a class in embryology. So in embryology, we study the embryonic period of human development from the moment of conception to the point where everything is there. Now it just gets bigger. So early on in our life, in our development, so it's pretty much the first trimester. So early on, we look like this. This is a ball of cells, and all the cells look alike. So we call it a blastomere at this phase of the game. But the ball of cells gets bigger with more and more cells. So they start replicating more and more frequently. And then eventually it gets big enough that it starts to fold inward and starts to form a tube of cells. Now, this is critically important to understand when it comes to kidney disease, because this tube is going to be forming into what we call the neural tube, which gives rise to the entire limbic brain. So that's the inner part of the brain. So the core of the brain, which features things like the hippocampus, the hypothalamus, the pituitary, all of those are parts of what we call the limbic brain, the primordial brain, if you will. Some people would call it the primal brain. And all of that is connected to the entire length of the spinal cord. Now, the spinal cord is going to connect to all the organs, including the kidneys. All right, so all the things that happen in our body, once the system is turned on, it's going to be always on. And the professor said, this is an electrical system, and it's just like any other electrical system. So you've got two currents, a positive current and a negative current. So the positive current is the parasympathetic branch of the central nervous system. When it is on, it's going to affect all the organs in a particular way and all the cells in a particular way, including the kidneys, okay? Including the kidneys. They're not listed here, they're not shown here, but it's going to affect the kidneys as well. Now, the negative current of the central nervous system is the sympathetic branch of the central nervous system. And when it is on, it's going to affect every organ system in the body, every cell in the body, including the kidneys. All right, so it's going to affect every organ system. The kidneys are included in this. Everything is affected by what state we are in. And what the professor said next is what got my attention, because he said, once this system is turned on, it's on 24/7 for the rest of our lives. It's the first system on, it's the last system off. However, once it's on, we are either operating in the parasympathetic state or the sympathetic state. At any given moment, we can go back and forth between the two, but we do not operate both at the same time. That would cause a short. So we don't do that. We operate one or the other. I got the or that Dr. Kalitsky was trying to teach me 3 years before, that we are either surviving in the sympathetic state or we are thriving in the parasympathetic state. And that's all there is. That's all there is. I finally made that connection. So it was very powerful to see this, because when we see how this connects to kidney disease and every other chronic disease, is that when we're in the sympathetic state, we're reacting to stress. The brain is thinking, is automatically, it's going to react to stress. And so we are going to function from a place of survival, and all our primal aspects of our brain are going to kick in. So fight, flight, freeze, or fold are going to be functioning at that state in time. Now, even as subtle as a perceived threat is enough to induce the fear and put us in the sympathetic state. But what is clear in the literature is that the common thread of all chronic disease is being in the state of dis-ease far too much. Far too much. And this is true of kidney disease, cardiovascular disease, cancer, diabetes, the list goes on. So all of it is fundamentally being in the sympathetic state far too much for whatever reason. All right, now what we need to be able to do, and what lifestyle medicine is all about, is being able to shift the central nervous system state. Let's not give you a pill and keep you in the sympathetic state. That doesn't make sense. What we need to do is shift your central nervous system state to being predominantly in the parasympathetic state. That is what's going to help you to heal. Because when we're in the parasympathetic state, everything works. Everything works. And it works the way it's designed to work really well. And we heal and we experience ourselves powerfully in a very, very different state. So that's what lifestyle medicine's goal is to be able to do that. Now, what shifts our central nervous system state? Is it anything that we have any control over? Turns out, yes, we do have control over what can influence our central nervous system state. Even though it's automatic, it's going to automatically react to whatever is stimulating the central nervous system. But we do have control. I teach for years, I've been teaching this, that there are 5 elements that we have total control over that influence our central nervous system state. Everything affects our central nervous system state, but these 5 we have total control over. Number 1 is the thoughts that we think, because if we have negative stinking thinking, we're going to be in the sympathetic state. So we need to have the power of positive thinking to keep us in the parasympathetic state. The words that we speak, if we're complaining, if we're gossiping, if we're being critical, cynical, and skeptical, well, guess what? We're going to be in the sympathetic state. So we need to have positive, empowering, uplifting words in our vocabulary. And it's not only the words that we speak, but it's the words that we listen to. So this affects our central nervous system state as well. So the actions that we take, because actions speak louder than words. So if we make promises to ourselves or to others, and then we break our promises and we never do anything about it, that's going to put us in the sympathetic state automatically. So we need to be able to walk our talk and practice living a life of integrity. Powerful. The company we keep, we have so much more research now showing the powerful impact of the connections that we have in our life. Not only are we affected by the 5 people we most associate, but it's all of their friends and all their friends. I mean, there is so much of an impact by the connections that we have in our life. If we surround ourselves with people who have stinking thinking and are negative, cynical, and skeptical, and critical, and gossiping, and complaining all the time, well, guess what? That's going to pull us into the sympathetic state. No kidding. So we need to surround ourselves intentionally by people who are uplifting and encouraging and positive and supportive. So that's really important. And then the fifth is the one that's the mind blower for the most people, and that is the food that we eat. Food absolutely affects our central nervous system. It does. It absolutely, if it puts us in the sympathetic state, there is an entire cascade of inflammation and neurotransmitters and everything else that goes on when we eat the foods. I don't call them foods. I mean, they're food substances. All right. Yes, you can put them in your mouth. It doesn't mean it's actually healthy for you. So food can either trigger a sympathetic reaction in the body or a parasympathetic reaction in the body. And it's profound when we understand this. So it makes a powerful difference. Not only that, but in lifestyle medicine, we talked about all these areas. So hydration makes a difference. If we don't have enough hydration, we're in the sympathetic. We have plenty of hydration, we're in parasympathetic. Nutrition, we just talked about. Physical activity, we need to have sufficient physical activity. In fact, we know if we have enough physical activity, we're happier. Yeah, we're absolutely happier. So we need to have sufficient physical activity. If we don't, then yeah, it's depressing. Harmful substance reduction, we're going to talk more about this later, but alcohol, caffeine, and nicotine absolutely affect us, and they put us in the sympathetic state. Sleep is critical for our health. We need to have enough sleep. We don't have enough sleep. Yes, it absolutely puts us in the sympathetic state. Having the right amount of sleep and the right quality of sleep improves our ability to be in the parasympathetic state. Emotional well-being, stress management, critical for our health. Absolutely imperative that we manage it well. And healthy relationships. It turns out in the research that healthy relationships are even more important for your health and longevity than your cholesterol level. Yep. So we need to really be mindful of all these things. We are complicated as human beings, but there are 4 basic energies that we need to be mindful of. Everything affects us. And this is true for kidney disease. Kidney disease is just, it's an indicator light if we've got it. That's all. What we need to look at is all the aspects that I've just talked about, and then our spiritual, physical, mental, and emotional energies. These are the 4 energies that drive us as human beings. Physically, our food, our exercise, our sleep and resting. But mental energies, our ability to focus, concentrate, to be able to solve problems with clarity, no distractions. Our emotional energy is critically important for our health and well-being. How we feel, having positive emotions and engagement levels, being valued by others, and feeling that for ourselves, critically important for our emotional well-being. Our spiritual energy is our sense of purpose, not about religion here. So sense of purpose, our values and needing to matter. Those are the things that really drive our spiritual energy, being able to make a difference. So these are the things that are critical for our health and well-being as well. So now with this as the context and the framework for our health, let's turn our attention to kidney disease. All right, so let's look at kidney function. First of all, let's look at normal function. So if we look at the human body, what we see is we got 2 kidneys. You got a right kidney and you got a left kidney. So you got these kidneys here. Yes, one is a little higher than the other. That is normal. You usually have the right kidneys a little bit lower, left kidneys a little bit higher. All right, that's usually the case. Now you have ureters, which come from the kidneys into the bladder, and to be able to provide the urine that our body's going to then excrete. So there's different features of this. So we have the renal arteries are going to provide the blood that is needing to be filtered. So the kidneys are the filtration system of our blood. That's their function. It's really, they're amazing little organs, really, they're amazing. And so we're going to deliver the blood to them via the renal arteries. Now, notice it's not 100%. So this big artery here is the aorta. So most of the blood keeps going and to the rest of the body. So it's just a small portion of the blood that's going to go into the kidneys. So we need to have these kidneys working all day, all night long in order to do the job of filtration. So if you had a pool, for instance, a swimming pool, and you wanted to have nice, clean water, you'd need to run the filters enough period of time in order for that water to stay clear. So the same is true for the human body. Now we've got a lot of blood, and we got about 5 liters of blood. And so we need to be able to filter that blood on a frequent basis, on an ongoing, and in fact, it's 24 hours a day that our kidneys are doing the work. They're hard working. Yes, they're working all the time. So those renal arteries are going to deliver the blood into the kidneys, and this is the cross section here. And then they're going to go through the job of filtration, and then they deliver the waste into the ureters. And then the good blood, the nice clean blood, is going to go back into the renal veins in blue here. And then that'll get taken right back up to the heart to be delivered again. So we got this cycling system. This is completely cycling in all the time. It's quite amazing. And if we look at the cross section of a kidney, we can see all these different features. I'm not going to teach you anatomy and physiology today, but I just want you to see all these different things. But it's quite extraordinary. It's just this compact, amazing filtration system. Think of your oil filter in your car. Think of your gas filter in your car. I mean, this is what your body's doing. It's filtering out the blood, which is the energy supply of our whole body. So it's doing it and keeping it nice and clean. And so we need to make sure that it stays healthy because it's a live, active system. It's not a passive filter. It is an active filter. So we need to keep it healthy. It's a living organ. All right. So all of these different features of the kidneys. Now, what it does, so I want to bring your attention to here. So in order for the kidney to do its job, so the blood with the waste, which comes in from the renal artery, is going to come in and deliver the blood. So we're going to look at this area close up. So this area, there's something called the glomerulus. All right, so the glomerulus is where we've got all of these capillaries, these small little capillaries. And so they're really, really thin, very delicate, very, very, very delicate. And they're very sensitive because they have one cell layer thick of endothelial cells. Now, endothelial cells are the same kind of cells that are inside your mouth. So go ahead, put your tongue up against your yeah. So those are endothelial cells. Now in your mouth, you got about 8-9 layers thick. All right, in your capillaries of your glomerulus and your kidneys, you got one cell layer thick. It's super thin and you could see right through it. I mean, if you were to hold it up. Now, you know what it's like when you've bitten your cheek, right? And then a minute later, you do it again. Oh, what's up with that? All right, so the thing is, then now you put your tongue up against your cheek. Oh, it's tender. Oh, it's a little swollen. You can feel it. You can feel it's raised, and it's very, very tender. Now, that's inflammation. That's inflammation that you can feel in your blood vessels. You'll never feel it. There are no nerve endings there. So that's why kidney disease is so sneaky, because there's no nerve endings here in the glomerulus whatsoever. You've got nerve endings in your cheek, but you don't have them there. So we got to be, this is really delicate in here. And this area is called, what holds it is called the Bowman's capsule. And then what happens, it filters all the waste out. And then the waste gets collected in these ducts, what we call the nephron, and then into the collecting ducts and goes out as urine. And then what happens, the blood gets clean going through this process multiple times, and all the waste gets purged. And then we get blood without waste, which is really great, comes back in the renal vein and goes back up into the circulation. So that's a beautiful thing. Now, so one of the things that I got to see was kidney disease. You could actually see it in the kidneys when I did autopsies. So it's very, very interesting to see. And I've seen healthy kidneys as well. So it's very interesting. Normal kidney function is at 100% here. So this is really important to get. So normal kidney function looks good. It's doing really great. Not a problem there. But when kidney function drops down to about 33%, now, I don't know about you, but I think that's pretty drastic. That means it's 2/3 less. Okay, at that point, they say it's early kidney disease. Like, to me, I mean, when you drop 1/3, I think you should call it early kidney disease. But in the medical world, this is what they do. So they call it acute kidney disease once it's dropped down to 1/3, 33%, all right, that we call early kidney disease. And then even less is stage 2 is mild kidney disease. Mild? Are you kidding me? You're wow. And then they call it uremic kidney disease is at 25%, stage 3. Now the doctors get alarmed. Before then, they don't. I don't know about you, but I think that's a little ridiculous. I mean, we need to be more proactive, and that they don't call it end stage kidney disease until we get all the way over here and you got 10% kidney function or less. 10%. Are you kidding me? I mean, we should be doing that way back here. All right, so we don't do that, and we're not proactive in the medical world. That's just not the way it is. So this has been how it's been classified for a long period of time. But at this stage, we can see a lot of damage. It's really interesting. We've known about this for a long period of time. In fact, in 1858, Rudolf Virchow, the father of modern pathology, was the first to describe the fatty degeneration of the kidney. Back then, I concurred from what I did. I did autopsies in 1980, 1981, all right, and early 1982. So finally in 1982, this idea of lipid nephrotoxicity, the possibility that fat and cholesterol in the bloodstream could be toxic to the kidneys directly, based on data showing plugs of fat literally clogging up the works in autopsy kidneys, was finally formalized. It took over 100 years to finally get them to say, oh yeah, it's the fat and the cholesterol in the diet that's causing this. Over 100 years. Oh my goodness. Some things are a little slower than others. So chronic kidney disease. So chronic kidney disease affects greater than 10% of the adult population. Each year, approximately 120,000 Americans develop end-stage chronic kidney disease, all right, and initiate dialysis, which is very costly, and it's associated with functional impairments as well. Worse health-related quality of life and high early mortality rates exceeding 20% in the first year. In the United States, this stat was very shocking to me. In the United States, approximately 1 in 3 adults aged 65 years and older has chronic kidney disease. Look to the left, look to the right. One of you's got chronic kidney disease. That's shocking. That's shocking. The scariest thing for many kidney patients is the fear of dialysis, but they may be 13 times more likely to die than go on dialysis. With heart disease killing more than nearly all other causes combined, decreasing kidney function, it's a vascular condition, can set one up for heart attacks, strokes, and death. And most of the time when people die from heart disease, they've got kidney disease or other kinds of issues going on. And people who have kidney disease, they usually die from heart disease. So it's a vascular condition. It's a vascular condition. So it can be deceiving to think that, oh, it's not that significant. Hardly anybody dies from kidney disease. Think again. All right, think again. Now, diet and chronic kidney disease. Remember, they finally made the link. It took them over 100 years. So this is finally published in Advances of Nutrition in 2019. So kidney disease, and I hope I have some health professionals here with me today because I pulled out the stops for you guys today. All right, so kidney disease affects almost 15% of the US population, and prevalence is anticipated to grow as the population ages and the obesity epidemic continues due to Western dietary practices. The densely caloric Western diet, characterized by high animal protein and low fruit and vegetable content, has fueled the growth of chronic diseases, including chronic kidney disease. The glomerulus, or filtering unit of the kidney, is very susceptible to barotrauma, and diets high in animal protein impede the glomerulus's ability to protect itself from hemodynamic injury. High animal protein intake combined with low intake of fruits and vegetables also leads to a high net endogenous acid production, requiring augmentation of ammonium excretion in order to prevent acidosis. This higher workload of the kidney to maintain a normal serum bicarbonate level may further exacerbate kidney disease progression. So to all my health professionals, look it up. Here's a citation. I'm sending you this in the email as well. All right, you got to get it. All right, this is straight from the top. This is research-based information that you need to start changing your practice as a health professional. If you diagnose kidney disease, you need to get the connection between diet and chronic kidney disease. So, I mean, it's really obvious. I'm going to expand on this. If we look, it's obvious. It's obvious. This is straight from the USDA. All right. Americans get only 12% of their diet from plant foods, 25% from animal protein, and processed foods account for 63%. This is an abuse to the body, especially for the kidneys. If we look at the healthiest outcomes amongst the longest living people on the face of the planet, what we see is obvious. All right, let's look at the blue zones, and in Okinawa, the healthiest group there, the best health outcomes. Guess what? Their diet, 97% plants. That's what their diet is comprised of. Wow. Wow. Now, Canada wised up. They wised up. In fact, their clinicians are on board with this, all right? Canada wised up, and they redid their food guide based on the research. And here's what they're recommending is for people to be consuming a minimum of 88% plants in their diet. We are so far behind in the United States. It's tragic. It is absolutely tragic. So we need to get our act together here in the United States, and we need to start wising up as far as what we need to do. And this is based on the research, my friends. So now let's look at what are some of the measures of kidney function. So if we look at that, let's look at what is urea. So this is one of the basic things that we measure when we're looking at your blood values to see how your kidneys are doing. So urea is so excess amino acids cannot be stored by the body. I want to emphasize this because a lot of people think I need more protein. I need more protein. I need more protein. I got to get all my amino acids. I need tons more protein. I got to build my muscle. So here's the thing, your body cannot store it. You got to get this, all right? You store fat, you store a little bit of carbohydrate and this glycogen in your cells, all right? Store just a little bit, but you cannot store protein. Okay, so excess amino acids, if we ingest too much amino acids, okay, it can't be stored by the body. Cannot. So what has to happen? Has to be excreted. So the liver is going to remove the nitrogen part of the excess amino acids, we call it the amine group, all right, in order to form the urea molecule, which is down here. This is called the urea, all right? So we're gonna strip that amino acid apart, form this urea molecule, and the remainder of the amino acid is going to have all the carbon, hydrogen, and oxygen atoms that can be used to release energy. So we are very efficient. The body's going to use it for energy, and this is called deamination. All right, now urea, this molecule now is going to leave the liver. All right, the liver is going to be doing this process in the blood via the hepatic vein, and it travels with the bloodstream until it reaches the kidney because it still needs to get excreted. So it's going to travel to the kidney. The urea molecule, also referred to as nitrogenous waste compound. All right, so that's what's going to have to happen. So we can measure this. We can measure this. So we're going to look to see, all right, the blood urea nitrogen. So remember, so we'll get excess excess protein in the diet going to be converted via the urea cycle in the liver, and we're going to get in this blood at this point when it gets dumped out of the liver into the bloodstream. We can measure this blood urea nitrogen before it actually goes to the kidney to get the urea excreted in the urine. So we can actually measure that. So blood urea nitrogen is a medical test that measures the amount of urea nitrogen found in blood. The liver produces urea in the urea cycle as a waste product of the digestion of protein. All right, so when we have excess protein, all right, especially animal protein is going to be the highest because we can't even use that. So in general, around 7 to 20 milligrams per deciliter is considered normal, but normal ranges may vary depending on the reference range used by the lab and your age. So you're going to have to ask your doctor to explain your results. Urea nitrogen levels tend to increase with age because people tend to have poorer kidney function. So we see, and they have more protein in their diet. So we start to see higher levels of BUN. Now, the thing is, you should have very little. If you're consuming plant protein, you're going to have much lower levels of BUN. If you're consuming animal protein, you will have much higher levels of BUN. So it's a very indicative test. All right. Another test that we measure is creatinine. All right. So creatinine is a waste product from the normal breakdown of muscle tissue. Now, most people don't break down their muscle tissue very much. All right. If you're exercising a little bit, yeah, you're going to break down your muscle tissue a little bit. All right. If you're over exercising, yeah, you will break down a little bit more muscle protein. If you're consuming a lot more meat, dairy, and eggs, if you're on a paleo diet or a ketogenic diet, you're going to break down a lot more muscle protein. All right. You're going to definitely do that. And if you're fasting and you're not eating on a consistent basis, then you're going to break down muscle protein as well. All right. So if you're not eating consistently enough, you're going to break down muscle tissue. So you'll see that and you'll have more creatinine in your blood. So as creatinine is produced, it's filtered through the kidneys and excreted in the urine. So the doctors measure the blood creatinine level as a test of kidney function. But what I'm going to look at is your lifestyle. I'm going to look at what's going on. I'm going to look at your diet. I'm going to look at everything that's going on. What's causing the creatinine to go up? All right. So the doctors are going to say, oh, you got high creatinine, we'll just give you a pill. All right. No, that's not their approach. So if your level is high, your doctor should recheck it. If 2 or more levels are high, you may have kidney disease. So normal serum creatinine level range is 0.6 to 1.1 in women and 0.7 to 1.3 in men. It compares creatinine in your blood and your urine. So they're going to do that as well. So they're going to do a urine test to see exactly how much creatinine is spilling into your urine. So the thing is, I'm looking at your lifestyle. I want to look to see exactly what's going on. Why is it that you're breaking down muscle tissue? For what cause? So we need to look at that. That's looking a little further, a little deeper. In addition, another test that we usually have, which we measure through the blood, is glomerular filtration rate, GFR. So you may see that from time to time. And also the albuminuria categories. All right. So when you look at that, if your GFR is over 90, we consider that normal or high. So that's very, very high to see. That's how effective your kidney is filtering the blood. So the glomerular filtration rate, how effective, that's basically telling us how much of your blood is it being able to filter on an effective basis. When you get down to here, less than 15, you're in serious trouble. That means your kidney is not able to filter the blood very well. It's having a very difficult time filtering the blood. So very little of it is actually getting filtered, which then leads to the buildup of toxicities in your blood and all kinds of problems. So this is really concerning. This is when we see people having kidney disease, their glomerular filtration rate gets lower and lower. So we want to see it definitely over 60. I like to see it, over 90, but but definitely over 60. So we want to see that. All right. So now those are some of the tests. Now, here's the thing. In fact, I'm going to read these questions. I had somebody send me this email. All right. So seems that the BUN test is the most accurate, comprehensive one. That being the case, why bother with the other two, which can only alarm the patients? All three tests require blood draw, so the procedure is the same. Look, consider this. I'm going to read the next question too. They only give the GFR ranges for African and non-Africans, yet there are either more Chinese or Indians in the world than anyone else. How can we get this changed? Third question, GFR top function is like 100 to 110 or higher, yet tests only give you results as above 60 or below 60, at least at Kaiser. But at 60, you're already at stage 3 chronic kidney disease. That's actually not correct, all right? But again, how to get meaningful GFT test results, or should one bother since the BUN test is the best and most accurate one anyways? So the thing about it is that these are great questions, but they're great questions in the medical world, all right? So the perspective to look at here, it's not about the test. It's about your lifestyle. So what I'm going to look at as a lifestyle medicine professional, I'm going to look at what's your lifestyle that's contributing to any changes, the BUN, creatinine, or the GFR. I'm going to look at I'm going to look at your lifestyle. What's contributing to those changes? And we need to look at the whole big picture here. So it's not about the tests. The tests are only an indicator light. So it's sort of like these are your check engine light. You know how it is when you have a car. If your check engine light goes on, you don't know where exactly the problem is, but you know there's a problem. Now, one of my friends used to get the check engine light to go on, and she would say, and I would ask her, I say, did you notice that your check engine light is on? And she says, oh yeah, it's been that way for a while. I said, really? I said, what do you plan to do about it? She said, well, I'm just hoping that one day it'll go away. Oh, I said, you've got to be kidding me. No, the check engine light means you need to take it to a mechanic right away so they can actually put the sensor on and find out exactly where the problem is, because you got the check engine light on, there's a problem somewhere. Sometimes it's simple, sometimes it's more complicated, but you cannot ignore your check engine light. So I want you to think of these lab results as ways to get your check engine light checked. All right, that's what we're doing. We're just checking the system, but we need to change the lifestyle. That's what we need to be able to do. So consider this, my friends, that genetics, as I mentioned before, genetics determines what type of disease you will get if you chronically harm your body. It's about 20% influence. So if you harm your body, the genetics is going to determine where the disease is going to show up. It could show up in your kidneys. It could show up in your muscles with diabetes. It could show up in your heart. It could show up in your brain with Alzheimer's and dementia. It could show up in a lot of different places. Your lifestyle habits will determine the extent and duration of the inflammation that leads to the actual disease. That's 80% of the influence. So that's where we need to go. Now, the lab tests are helpful to a degree. They're limited, and the medical treatments of chronic disease are limited. They always are. They never reverse chronic kidney disease. They never do. That's one of the things that I got from my experience of being in medical school. I realized all this training, all this education about being able to treat chronic disease, not one treatment reversed the chronic disease. So we need to understand this. And so genetics loads the gun, but lifestyle pulls the trigger. It's the poor lifestyle habits that leads to the disease. So if we look at kidney disease, I thought I'd show you, this is what rotten kidneys looks like. All right, I thought I'd show you. I want you to see, this is what I saw on a few autopsies, okay? These are absolutely horrible diseased kidneys. Yes, these are kidneys. So we have determined in the research there's 3 major factors that contribute to kidney disease. And Dr. Virchow started to see this back in 1852. All right, so animal protein in the diet, animal fat, and cholesterol. Now, I'm not going to go into cholesterol because I have an entire webinar just on cholesterol. I'm going to go into animal protein, animal fat. So we need to go into that. All right, so let's go into that. So if we look at animal protein, it's very, very clear to see. High protein diets with high meat intake, not only result in higher cardiovascular disease risk, but also higher chronic kidney disease incidence and faster chronic kidney disease progression due to increased intraglomerular pressure and glomerular hyperfiltration. That means that the kidney's having to work harder to try to get things done. Now, meat intake increases the production of nitrogenous end products. We talked about the urea, right? And it worsens uremia and may increase the risk of constipation with resulting hyperkalemia, which is potassium, from the typical low fiber intake. Well, okay, what do we do about this? So now if we look at this, if we examine this animal protein, I mean, people say, oh, I gotta have my protein. Do you have any clue what you're doing to your body? People just don't have a clue. They don't. So there is an overload that occurs from having animal protein. In fact, we put it to the test. All right. So there's inflammation that occurs. Now the thing is, it's in a matter of hours. All right. A lot of people say, oh, it happens slowly over time. No, we actually put this to the test. So what we did is we had two groups of people. All right. We had a comparison of vegetable-based bean. So they have bean curd versus a meal with tuna fish. All right. Tuna fish meal. All right. So what happens? So the ratio of glomerular filtration rate after protein loading to baseline compared to baseline. So what happens is that in the bean curd, everything stayed healthy, but within hours, the GFR raised very, very quickly in the people with the tuna fish meal. All right. So the ratio, that means the ratio raised, that means that their GFR actually decreased, and it decreased very quickly, very, very quickly. The acid load ends up causing what we call tubular toxicity. All right, so tubular toxicity means those tubes in the glomerulus get toxic, and it really causes a problem. A lot of people say, well, fish is good to eat, right? No, fish is actually the worst when it comes to kidney disease, followed by pork and poultry. All right, I'm gonna show you a graphic on this in just a moment. So absolutely the worst in terms of the acid load. Now, what we also showed is that if, in terms of protein loss, we have this research that was done in 1990. And so what we did is we took a group of patients, and what we did is we put them on a low sodium diet with animal protein, LSD, not the drug, okay? Low sodium diet. And then we alternated them with a supplemented vegan diet, all right? So a vegan diet, all plants, no animal whatsoever. And what we showed as far as protein excretion, so urinary protein excretion, the higher the urinary protein excretion, the more kidney disease, all right? We don't want to lose urinary protein. So when they're on the low sodium diet, it was higher. And then we switched them to the vegan diet and it dropped. And then we put them on the low sodium diet with the animal protein and it rose in terms of urinary protein excretion. And then we put them on the vegan diet and it dropped again. And then we put them on the low sodium diet again and it rose. And then we put them on the vegan diet again and it dropped again. So, I mean, it was just like this. I mean, you change the diet and it changes the protein loss in hours. All right. So it's just really critical to see this. So we have that to see. So this is the research that we've done. This has been done for years now. We have in this country an obsession with protein. I mean, it's an obsession. People are obsessed with it. I can't even begin to tell you how much obsession there is with animal protein. Animal protein is linked to multiple chronic diseases, including exacerbation, acceleration of kidney failure and kidney stones, and chronic kidney disease. For those of you who are obsessed with protein, or if you know people who are obsessed with protein, please get this book, Proteinaholic: How Our Obsession with Meat is Killing Us and What We Can Do About It, by my good friend, Dr. Garth Davis. So you want to make sure you read this book. There is such an adverse mechanism, animal protein. Everybody says, well, I need animal protein because I need to grow my muscles. Well, you're going to get all the essential amino acids in animal protein. So meat, dairy, and eggs absolutely are loaded with the essential amino acids, but we don't need that as adults. We need that as babies, but not as adults. Okay, and we don't need it from animals ever. All right, we need it from our mother's milk when we're growing. That's all we need. So there is an adverse mechanism. So I thought those of you who are nerds, I thought I'd nerd you out today. All right, so my fellow nerds. So the thing about it, there is one in particular, one essential amino acid is leucine. Well, meat, dairy, and eggs happen to be very high in leucine. So when we have leucine in high amounts in our diet, it actually triggers these oncogenes called TORs, mTOR genes, which are growth promoting enzymes, growth. All right, so they stimulate growth. And so now it's good to have that in infancy, but not as an adult, because that leads to cancers, tumors, extra growths. So that's what it does. So when we have this excess amount of essential amino acids from the leucine and from animal proteins, that's one of the causative factors. So I thought I'd show you this because you want to see this. This is from my good friend, Dr. Milton Mills, and he showed this leucine in animal and plant foods, the difference between the two. So what we see is that plant foods have very low normal levels of leucine, very, very low. But when we go to eggs, dairy, and meats, the leucine levels are exceptionally high and detrimental. So the elevated leucine levels turn on these oncogenes, and they increase the IGF-1 levels, which stimulate cancer growth, and even another amino acid is methionine levels also promote tumor growth as well. So that's why we need to stay away from the animal protein. These essential amino acids are in too abundant of supply for us, and they cause adverse effects. In addition is the acid load to the kidneys, all right? So when we look at this, the foods have a different amount of acid load. So the certain foods are going to cause a change in our blood pH. So here, in terms of the foods that cause the greatest acidity change in our bloodstream, number 1, fish. 2, pork, poultry, cheese, beef, and eggs, all right, all causing our blood pH to become more acidic, whereas bread, rice, pasta, beans, fruit, and veggies are not going to cause that kind of change at all. And they're going to be more alkaline, all right? So that's what we want to be able to promote. This acid increase is going to contribute to chronic inflammation. It's going to contribute to it. All right. So there's several factors that cause chronic inflammation. So saturated fat causes the destruction of the healthy microbes in the gut. It's going to cause an immune response. It's going to have tissue damage and hemorrhage as well. And then in addition, the arachidonic acid and the omega-6 fatty acids cause inflammatory immune mediators to be produced, and prostaglandins and leukotrienes also, they're also going to contribute to this chronic inflammation. So we want to stay away from those kinds of fats, especially. So if we look, not all fat molecules are the same. Fats are not just fats. So these are the molecular structured diagrams of 4 different types of fat molecules. So on the bottom are these polyunsaturated fatty acids. Now the reason they're unsaturated is because they've got these carbon-carbon high energy double bonds. Now this is carbon, H is hydrogen, O is oxygen. These high energy bonds, our body has enzymes that can use these to break them open and to reformulate them into useful compounds. We can use this in a very productive way, and these are anti-inflammatory. Whereas everything else up from this is going to be an omega-6. By the way, it's omega-3 because it's the 3rd carbon from the methyl group here. This is the methyl group. All right, so now this is the 6th carbon, so we call this an omega-6. It only has 2 carbon-carbon double bonds. All right, so it's the same pathway, but different effect because these are going to stimulate inflammation. Whereas the monounsaturated fat, only one carbon-carbon double bond, it's an omega-9, definitely contributes to inflammation. And then this up at the top is what we call a saturated fatty acid. So all the carbons are saturated with hydrogen. Our body can't use this at all. This is a fat that is basically dead. It has no biological potential for us. The only thing our body can do with it is roll it up and formulate more cholesterol, which we don't need. This compound, this saturated fat, contributes to inflammation, and it has the same biological activity as these modified saturated fats. Did you know that these are modified saturated fats? Yes, they are. Plastic, motor oil, diesel fuel, and gasoline are all modified saturated fats. They all came from crude oil, which came from dead dinosaurs. Yes, the animals strike again. All right, so this is what we want to stay away from. We want to stay away from them. We want to promote greater levels of omega-3, and we want to minimize and decrease the amount of omega-6s. Here's because the omega-6s are pro-inflammatory, whereas the omega-3s are minimally inflammatory and inflammation resolving. So that's what we want to be able to do. So the problem that we have in the American diet is that we've got people eating so much animal food that their omega-6 relative to their omega-3 ratio is about 20 to 1 times versus the omega-3, 20 times more omega-6s than omega-3s. This is the problem. This is the cause of the problem, the inflammation in people with kidney disease. Now, what we're supposed to eat is more of a ratio of 1 to 2, omega-3 to omega-6s. To heal, however, Dr. Goldner talks about being able to get the better ratio is closer to 1 to 1. So we need to hyper introduce omega-3s in order to drive that ratio up so that we can promote anti-inflammatory healing. That's what we're out to do. So this is really important. Now let's look at the fat, the animal fat. The animal fat is very important to understand. So to understand that, if we look at how energy is produced in the cell, what we see is this, is that the energy molecule adenosine triphosphate is produced maximally through these organelles inside the cell called the mitochondria. Now, for the mitochondria to do its job, we need these small free fatty acids. So we need these. By the way, the best source of them is going to come from fiber. Yes, short chain fatty acids. So we're going to get those. All right, that's what's going to be able to help us produce those free fatty acids. So we need to be able to do it because the microbes are going to change that fiber into all these short chain fatty acids. Woo! Isn't that great? That's how that works. So we need to have a lot of fiber in our diet in order to form these free fatty acids. Now, we need just a little bit of that. And the substrate to produce this energy molecule, adenosine triphosphate, is this molecule here, pyruvate, which is half of a glucose molecule, which comes from this glycogen. So either free glycogen or stored glycogen inside the cell. This is the gas pump for our car. Our body is a car. This is the gas pump. So when you go to the gas station, you pull up to the gas pump and you put gasoline in your gas tank so that you can go. You're going to burn that gasoline. But that gasoline is a refined fuel. It got refined from particular crude oil products, and it got refined and delivered. So the thing about it is that the crude product that we need to be able to develop this fuel source, this glycogen, are 2 specific carbohydrates. There are many, many different carbohydrates. Yes, refined sugar is a carbohydrate. Yes, it is. It's not healthy for you, but there are many types of carbohydrates. But there are 2 specific carbohydrates that we must have, amylose and amylopectin. Most people don't know about those, but these are the 2 specific carbohydrates that we must have in our diet in order to produce the glycogen, which then gets broken down to pyruvate and then is synthesized in the mitochondria with the fat in order to produce adenosine triphosphate. You use ATP for everything. It is your energy currency. So you must have it. You must have it. Now, what we showed in the research back in 2004 at Yale University, we discovered this looking at diabetics. And by the way, a lot of diabetics have kidney failure as a complication. All right, so we looked at diabetics, and what we saw was this, that these diabetics, their cells lit up with this inside the cell, these yellow pockets here, otherwise known as intramyocellular lipid, otherwise known as fat. Fat. Now, this was shocking to the scientists because we were the first time we were able to look inside the cell in a live setting. This is live cells. We're able to see what was going in and out of the cells. And this was shocking to see. We had never seen this before. And why it's shocking is this. The cell normally is about 90% water. Fat, intramyocellular lipid, is oil. It's oil. So oil and water don't mix. Oil and water lead to problems, and they lead to inflammation. So this same situation is occurring inside those capillaries inside the kidneys, in the glomerulus. And they have this very delicate one cell layer thick lining called the endothelial cells. So this same process is occurring when we have a high animal protein and high animal fat diet. That fat's getting inside these endothelial cells and causing problems. We're causing the oil slicks inside the cells. Inside the cells. And now what happens, that oil slick forms inside the cells and they can't function the way they're supposed to do. And these endothelial cells are so important inside the kidneys for being able to transfer the waste out into the collecting ducts for the urine. They have to be able to do that. So what happens, they get all this inflammation, and the same process happens in the heart, it happens in the kidney. It's exactly the same process. It's vascular disease. So you get these pockets of inflammation. You get these endothelial cells that get pockets of inflammation, just like biting your cheek. And so they get this inflammation, but the blood is flowing. The blood is flowing. And now this is so delicate. It's one cell layer thick, but it's diseased. It's inflamed, all right? It's engorged. So now what happens? It's going to start to tear, and it starts to tear open. It starts to form a blood clot. Well, the same thing happens in the kidney, but what happens is it starts to die. All right, it starts to become necrotic, and you start to have the capillaries actually start to just die off. So now you're not able to do this. So what is contributing to the fat? So all the sources of fat, we need to look at that. So number one is going to be all oils. All oils. I don't care what kind, okay? Coconut oil, canola oil, olive oil, doesn't matter. All oils are 100% fat. That's contributing to the oil slicks inside the cells, all right? And it's especially going to be problematic with any foods that are fried in oil. I mean, geez, take a perfectly good muffin and put it in a jacuzzi of oil, jacuzzi of fat. No, don't do that. So the chemistry on oils is plain to see. The research, it is not healthy for you. I know it sells like crazy. That's the advertising, that's the marketing. Do not believe it for a moment. It's going to decrease artery endothelial function. That's critically important in the kidneys. It's going to decrease flow-mediated vasodilation, the ability for the blood vessels to expand and contract. Increases triglycerides, which is going to increase all kinds of inflammation, decrease oxygen transfer, and decrease waste transfer in the kidneys. Sympathetic response, more inflammation, increased cholesterol, right? So none of this is good. None of this is good. So we have research studies on all of this. Dr. Esselstyn says this for the heart, but guess what? It's the same for the kidneys. No oil. No oil. So I hope I get that point across. Now, we've talked about meat already, but guess what? There's a lot of fat in meat. So all meat, including beef, pork, poultry, fish, and eggs, all of it is problematic for the kidneys. It all is, especially the processed meats. There's so many toxins in meat, so many. Oxidized cholesterol, reactive aldehydes, new 5-GC, endotoxins, trimethylamine oxide, I'm going to talk about that in a second, carcinogenic heterocyclic amines, especially when you barbecue. Heme iron increases the risk of strokes and cancers. Bioconcentrated pesticides, herbicides, heavy metals, hormones, and antibiotics. Does this sound like a good food label for your children to be eating from? I ask you, come on now. All right, so this stuff is toxic. I mean, there's so many toxins here. And in case you didn't know, The World Health Organization in 2015 set up a team of their best scientists worldwide to review over 800 research studies, and they concluded that all processed meats, so your sausages, your hot dogs, your bacon, your salami, your pepperoni, yeah, those pepperoni pizzas, think about those. Largest selling pizza in the United States are pepperoni pizzas. Wow, that is labeled now as a class 1 carcinogen, same as asbestos, plutonium, nicotine. Class 1 carcinogen causes, unequivocally causes cancer. And then all the rest of the red meats probably cause cancer, probably. I mean, hold a baby in your arms and say, you know, I'm only going to give you stuff that's probably going to give you cancer. Would you really want to do that to your baby? Come on now. I mean, get it straight. Don't do that. Please, please, please. If you have children, grandchildren, great-grandchildren, please do not feed this to them, okay? Stop that. Stop the abuse. And those of you, men, all right, men, I'm talking to you for a moment. Men, for you, I want you to know that all that meat is your erectile dysfunction starter kit, okay? It is, all right? Ladies, if you enjoy your man being healthy, then you need to make sure you get him off the erectile dysfunction starter kit, so do that. Eggs are not healthy, all right? I had people say, well, what about eggs? No, not healthy at all. One egg has the same amount of cholesterol as a Big Mac, and more than 60% of the calories from fat. And it also increases the risk of cardiovascular disease, cancer, diabetes, prostate cancer, and guess what? Kidney disease. All right, so put that on the list. In addition, all dairy is problematic. It is really a problem, okay? Milk, butter, cheese, yogurt, cottage cheese, and ice cream, all of it is a problem. It's not a health food at all. In fact, we're not meant for this at all. It's not a health food. All right, there is no species of mammal on the face of the planet that routinely nurses a different species of mammal by choice. There just isn't. So it's going to cause all kinds of problems. Chronic heart disease, kidney disease is going to contribute to it. It's going to allergies, asthma, insulin growth factor, all kinds of complications from having dairy. It's not a health food. All right, it's just a lot of marketing. The marketing, and you've got to realize the meat and dairy and egg industries have been paying billions of dollars in marketing, and it's very persuasive, but it's not true. It's not true. All right, so there's a lot of marketing that goes on, but it's not true. So this is why hundreds of Olympic and professional athletes have been dropping dairy from their diets, because they've got to understand the truth. It's just not a health food. All of these foods, the meat, dairy, and eggs, all contribute to the formation of trimethylamine oxide, which is really problematic when it comes to the kidneys. So red meat, poultry, liver, fish, milk, cheese, and eggs, they have these particular amino acids. They're called carnitine, phenylcarnitine, choline, and betaine. Now, these are foreign. These are not the amino acids that are essential for the human body, okay? These are foreign amino acids. And what happens is that we have to actually have a specific group of microbes in our gut to synthesize and deal with these compounds, because they're very toxic. So what we do is we end up managing these compounds by converting them in the gut to something called trimethylamine, which then travels into the bloodstream. So trimethylamine is now going to be shuttled over to the liver. Now, trimethylamine is also very toxic. So the liver, one of the biggest jobs of the liver, just like it does with excess protein, and it's going to convert those amine groups into urea, it now is going to try to convert this trimethylamine to something that can actually be broken down and excreted. But it's going to do this, it's going to oxidize it, because it's too complex here. So what it's going to do, it's going to convert it to trimethylamine oxide, which still has toxic effects, because now this is going to get released in the bloodstream. We're going to try to filter it out, but we really can't. We have to deal with it a little bit more. So it's going to cause damage. And what we've shown in the research is that this compound here, trimethylamine oxide, once it gets in the bloodstream, it starts causing all kinds of that inflammatory reaction. So this also is part of what contributes to the inflammation cascade. So it's going to do the same kind of damage in the kidneys as well. Now, another inflammatory agent in our food is going to be sugar. Refined sugar looks like a drug, sounds like a drug. Guess what? It is a drug. All right. So refined sugar has all kinds of negative side effects, and it promotes inflammation. Guess what? In the kidneys as well, because the kidneys are very sensitive to anything that's causing inflammation. And what we show is sugar is going to cause, the sugar overload can damage their delicate filtration system. Diabetes is one of the main causes of kidney failure. So we want to stay away from refined sugars. Now, fruit has sugar, yes. Whole fruit has fructose sugar, but it's combined with the fiber. It's completely an unrefined sugar. It's completely healthy, completely healthy. All right, so that's the thing. It's unrefined versus refined sugars. That's the difference. We also want to stay away from processed foods. Processed foods, I don't care if it says healthy choice or lean cuisine. I don't care. All right, that is all processed food. It's all unhealthy. Processed foods cause inflammation. They cause inflammation. All right, a source of most chronic illnesses as well as stress. So it's going to cause that inflammation. That's going to damage the kidneys. In addition, I want to be complete here. So alcohol is going to cause vascular problems for the heart, contributes to high blood pressure, increases the risk of stroke, damages your heart muscle, heart failure, abnormal heart rhythms, interacts with the medications. Do you think it's going to leave your kidneys unscathed? Think again. It's going to damage your kidneys as well. All right. Now, in addition, alcohol also contributes to cancer. This is a letter from the American Medical Association. Yes, they're coming around. And they wrote this in August of 2020. They said that there is no safe threshold for alcohol and cancer risk. None. There's no safe level. All right. And if you were to do the equivalence here, in terms of alcohol and cancer, one bottle of wine is the equivalent of 5 cigarettes in men or 10 cigarettes in women. So it definitely causes problems. So that's alcohol. Smoking, everybody knows that it causes problem and it's toxic. Nicotine is toxic. It causes all kinds of problems. One pure drop of nicotine on your skin. I learned this doing organic chemistry. One pure drop of nicotine on your skin will kill you instantly. You'll be dead within 5 seconds. Dead. That's how toxic it is. Nicotine increases your risk of death. Now, if you know anybody that smokes, get them this book. This is a fabulous book, Alan Carr's Easy Way to Stop Smoking. All right, so you want to make sure you get this. This is absolutely a fabulous book. Now, the kissing cousin of nicotine. Kissing cousin of nicotine. I learned this doing organic chemistry in my undergraduate years. Dr. Wiley said, today we're going to extract either nicotine from tobacco leaves or caffeine from tea leaves. You get to choose because the process is exactly the same. And it is. Why? Because nicotine and caffeine, their molecular structures and molecular weight and everything else very close to each other. Both of them are very similar compounds. They are alkaloids and they are fabulous pesticides. Did you know that? Yes, caffeine and nicotine, fabulous pesticides. Yes, you can put your coffee grounds in the garden and it will kill all the snails, guaranteed. Absolutely the case. So caffeine is a fabulous pesticide. Now, a lot of people say, well, the research shows that there are benefits to having caffeine if you've got kidney disease. Yeah, it will increase your glomerular filtration rate. Yeah, it will. Yeah, it will, because it's a diuretic, right? It will do that, but it's going to cause all kinds of other problems. And they're not reporting that in the research. Now, here's what we do start to show now, that consumption of these energy drinks, lots of caffeine, lead to significant increased risk of arrhythmias and up to a, get this, 500% increased risk of stroke. So if it's doing that in your brain, what do you think it's doing in your kidneys? Think. I mean, the whole vascular system is connected. Logic has to pervade here. All right. Just because a research study or even a whole bunch of research studies that were paid for by the coffee industry show that having coffee is actually beneficial in being in kidney disease, don't be misled. That's marketing. All right. Remember, 70% of all research studies are paid for by private industry in order to support their marketing efforts. 70%. 70%. So you have to be able to tease out all these issues here. So other factors that contribute to inflammation: physical, emotional, mental, spiritual stress, absolutely. Inadequate hydration, poor sleep, sedentary lifestyle, stressful relationships, alcohol, tobacco, and caffeine all contribute to inflammation as well. Now, let's look at some of the research. So what we've seen in some of the research is very, very exciting to see in the research, now that I've thoroughly depressed you. All right, so the thing is, it's very exciting to look in the research how changing your lifestyle and your diet can actually make a powerful, impactful difference. So what we did is we had an 8-week randomized clinical trial to assess inflammation differences in post-angiography patients with coronary artery disease. Now, think, it's the same thing: vascular disease in the kidneys, vascular disease in the heart, same situation, same condition. So what we did is we took a group, we randomized the group, split them into 2 groups, right? 49 in the American Heart Association diet and 48 in a vegan plant-based diet. So what we did, we took half the group, we put it to the test, and we had them follow the recommended American Heart Association diet, which happens to have meat, dairy, and eggs in it. All right, so it's got pro-inflammatory foods in that diet. And then we had the other group with a completely whole food, plant-based vegan diet. Now, what we did is after an 8-week randomized clinical trial, we measured their C-reactive protein, which is a marker for inflammation. And the vegan diet resulted in a 32% lower high sensitivity C-reactive protein when compared with the American Heart Association diet. And all of them were below the baseline. As a result of this research and other research studies, the American Heart Association now supports a whole food plant-based diet as optimal for health. Isn't that exciting? I think that's so exciting. All right, so they've changed shit because they put their diet to the test, and now they said, well, we've been proven wrong in an 8-week randomized clinical trial, so how could they say otherwise? So they've changed their tack. In fact, we see so many scientific organizations already coming on board with supporting a whole food plant-based diet. So we see this. So when consuming a whole food vegan diet, it was found that inflammation in the body lowered drastically. The main nutrients found exclusively in plants that help combat inflammation are phytonutrients. These phytonutrients, including antioxidants and polyphenols, exert anti-inflammatory properties. The more phytonutrients you consume as an athlete or as a human being, the faster your body can recover from exercise-induced inflammation and oxidative stress from anything. All right, so it really makes a difference. So it applies to anybody. So we're seeing what's happening with a whole food plant-based diet. We're actually seeing these plaques starting to stabilize and heal in the arteries. And the same thing can happen in the kidneys as well. So we can start to see those wonderful capillaries in the kidneys and the glomerulus start to heal. So that's what we want to be able to support and promote. So another research study, this is from Current Diabetes Reports back in 2017, diet and diabetic kidney disease, plant versus animal protein. Because a lot of people say, well, I gotta have my animal protein. So evidence suggests that dietary patterns that focus on plant-based foods, those that are lower in processed foods, or those that are lower in advanced glycation end products, AGE, may be useful in prevention of diabetic kidney disease progression. increasing plant-based foods, incorporating diet patterns that limit processed foods, or potentially lowering AGE contents in diets may be beneficial for dietary management of diabetic kidney disease. All right, my clinicians out there, get the message. All right, I'm delivering you the essence here that you need to be on board with. In addition, we actually even put this to the test. We put it to the test, and this was published in the International Journal of Epidemiology. Over 81,000 participants in this, and what we showed is those people who consumed an animal-based protein diet had a 60% increase in cardiovascular disease risk versus those who had a plant-based protein diet. And as a result, they had a 40% decreased risk of cardiovascular disease. That's incredible. This is a 100% swing. All right. So all my clinicians out there, you got to get, this is so profound. There is no drug. There is no drug that decreases the risk of cardiovascular disease this much. It doesn't happen. It doesn't happen. All right. So you just got to change the diet. So I love this research study from Nutrients. This is very recent, 2020. So in June. So plant-dominant low-protein diet for conservative management of chronic kidney disease. So pragmatic dietary interventions may have a role in improving chronic kidney disease outcomes and preventing or delaying dialysis initiation. Evidence suggests that a patient-centered plant-dominant low-protein diet, PLADO, Play-Doh, of 0.6 to 0.8 grams per kilogram per day, composed of greater than 50% plant-based sources, administered by dietitians trained in non-dialysis chronic kidney disease care, is promising and consistent with the precision nutrition. A plant-dominant, fiber-rich, low-protein diet may lead to favorable alterations in the gut microbiome, which can modulate uremic toxin generation and slow chronic kidney disease progression, along with reducing cardiovascular risk. Play-Doh is a heart-healthy, safe, flexible, and feasible diet that could be the centerpiece of a conservative and preservative chronic kidney disease management strategy that challenges the prevailing dialysis-centered paradigm. Clinicians, I hope you're getting this. Now, those of you who have kidney disease or anyone with kidney disease, please, please, please take all these slides to your physician. All right, make sure that they read everything that I'm providing for you here today. Make sure they get this. This is real important because the clinicians don't have the time to read all the research. You need to make sure you set them up for success. This is really important. In addition, they did this. Now, this is even more recent. November 2020, published in BMC Nephrology, a prospective study on total protein, plant protein, and animal protein in relation to the risk of incident chronic kidney disease. This 6-year follow-up study was performed on 1,639 adults aged over 27 years. Now, the results of this study confirmed an inverse association between plant protein intake and the risk of incident chronic kidney disease compared to animal protein, which demonstrates the protective role of plant-based protein in a diet on kidney function. Yes. Okay. All right. So we've got the evidence there. We've got a perspective. This is really exciting stuff for me. All right. Yeah, I love this stuff. Now, plant-based, another study. This is from Current Opinions in Nephrology and Hypertension, 2020. All right. Plant-based diets for prevention and management of chronic kidney disease. So plant-based diets should be recommended for both primary and secondary prevention of chronic kidney disease. So doctors should all be recommending a plant-based diet, all of them, Concerns of hyperkalemia, which is the high potassium, and protein inadequacy related to plant-based diets, which is what they thought of in the past, may be outdated and unsupported by the current body of literature. Healthcare providers in general medicine and nephrology can consider plant-based diets as an important tool for prevention and management of chronic kidney disease. Okay, again, take all of these studies to your provider. Make sure they read these slides, all right? Make sure they get this. In addition, this is most recent. Several doctors, including Dr. McMacken in New York at NYU, is part of this team, and they have published this, the Plant-Based Diets for Kidney Disease, a guide for clinicians. All right, so here's the summary. So I want to make sure you get this to your doctor. In recent years, a growing body of evidence has emerged on the benefits, and this was just this year, this is recent, on the benefits of plant-based diets for the prevention and treatment of lifestyle diseases. In parallel, data now exists regarding the treatment of chronic disease, kidney disease, and its most common complications with this dietary pattern. Improving the nutrient quality of foods consumed by patients by including a higher proportion of plant-based foods while reducing total and animal protein intake may reduce the need for or complement nephroprotective medications, improve kidney disease complications, and perhaps favorably affect disease progression and patient survival. In this In Practice article, we review the available evidence on plant-dominant, fiber-rich diet as it relates to kidney disease prevention, chronic kidney disease incidence and progression, metabolic acidosis, hyperphosphatemia, hypertension, uremic toxins, need for kidney replacement therapy, including dialysis, patient satisfaction and quality of life, and mortality. Further concerns of hyperkalemia and protein inadequacy, which are often associated with plant-based diets, are also reviewed in the context of available evidence. It is likely that the risks for both issues may not have been as significant as previously thought, while the advantages are vast. In conclusion, the risk to benefit ratio of plant-based diets appears to be tilting in favor of their more prevalent use. American Journal of Kidney Disease, this year, isn't that exciting? It's exciting, all right? This is really great news. If we can start to make ground here, I mean, we can really do this. So one of the things that Dr. Greger from his video, he says that the key to halting progression of chronic kidney disease might be in the produce market, not in the pharmacy. I just love that. So if we approach this problem from a standpoint of what's missing, as opposed to just focusing on what's wrong, the medical world focuses on what's wrong. Let's fix what's wrong. But if we really look at the problem from the standpoint of going past what's wrong to looking for what's missing that we could put in that could actually solve the problem completely. Let's look at Dr. Goldner's 6-step for reversing not only autoimmune disorders, but also inflammatory disease. And she has done this successfully with kidney disease as well, using supermarket foods. So here's your 6 steps. Number 1, eliminate all animal products, all types, okay, of meat, beef, pork, lamb, fish, chicken, turkey, all of it. Just eliminate it all. All eggs, all dairy, milk, butter, cheese, ice cream, all of it, because all of these have massive amounts of omega-6s and increase inflammation. And they all increase all causes of mortality by at least 50%. So get rid of them, number 1. Number 2, eliminate all oils. It doesn't matter what kind. All right, especially all the vegetable oils are very high in omega-6s. Even olive oil causes damage to the arteries, so we want to get rid of that. All right, so get rid of all the oils. Number 3, eliminate all processed foods, because these contain ingredients that are not naturally occurring, They're synthesized, they're man-made, they often don't need refrigeration, they have a shelf life of forever, you know, Twinkies can last forever. And then lots of trans fats cause inflammation, all right? So get rid of them. All right, so now that's the stuff we want to get rid of, the first three steps. Now, what do we put in? What's missing that we need to put in? We need to hypernourish with raw plants. All right, we need the raw plants, food as medicine. We need that. So greens, fruit, and vegetables as much as you want, ad libitum. That's what that means in Latin. So vitamins, minerals, phytoenzymes, phytonutrients, polyphenols, antioxidants, all these wonderful things in raw plant food that are available that our body can use to heal itself. Dark leafy greens in particular are excellent places to get a lot of these nutrients we want to hypernourish with. Spinach, chard, collards, greens, kale, lots of them. All right, all those greens. Cruciferous vegetables also are fantastic. Broccoli, kale, cauliflower. Knock yourself out. All right, go wild. All right, not just on this list. All right, go wild. Don't limit yourself. Hypernourish with plenty of raw plants. So you want to get these especially. What you want to focus on is having your refrigerator look like a garden that's teeming with life instead of a morgue rotting of death. All right, so you want it looking like this. This is what my refrigerator looks like. It's fabulous. Focus on consuming whole foods, not processed foods, and plant foods, not animal foods. So we want these kinds of foods, lots of them. All right, the benefits of this approach are vast. There's so many research studies that we're being able to show now. There's so many benefits of a whole food plant-based diet. It is quite extraordinary. Remember that the food that you eat can either be the safest and most powerful form of medicine, or it's the slowest form of poison. And every time you eat or drink, you're either feeding disease, like kidney disease, or you're fighting it. So you get to choose. You get to choose how it's going to be. This is my food pyramid. I will send you this with more information as well, just so that you get all the information. But stay in the life promoting field. So you want to have foods that are life promoting. Now, step number 5. Oh, by the way, this is what my diet looks like, just so you know. All right, so this is what I eat all the time. All right, I'm always eating this. So this is the salads. I have my oatmeal in the middle there. All right, I have fabulous salads. April makes these, and they're amazing. They're amazing. All right, just really amazing. All right, so now, step number 5. You want to heal from chronic kidney disease and the inflammation. You want to consume high amounts of omega-3s daily. So you want to take large doses of the high potency omega-3 foods. Flax and chia seeds. If you get a half a cup of those a day, that's over 20,000 milligrams of omega-3. I did the math, it's exciting. Woo. Leafy greens, spinach, kale, chard, beet greens, all excellent as well. Cruciferous vegetables, also excellent. Fruit that are very high in omega-3s as well. Jackfruit, papaya, and mangoes, excellent sources of omega-3s. But your best bet to hypernourish with those omega-3s and get those in is going to be your flax and chia seeds. So you want to be able to do those in a smoothie. They're really great to do. So the specifics on chia and flax: chia has a 3-to-1 ratio of omega-3 to omega-6. It's outstanding. Does not need to be ground up. 1 ounce contains just 5,064 milligrams of omega-3. Flax has a 4-to-1 ratio of omega-3 to omega-6, but it needs to be ground up in order to make those fatty acids available. However, if you do that in the air, the fats will oxidize if it's exposed to that air. So it's best to use it in a Vitamix, because the Vitamix is fabulous at being able to grind those up, and you have the water in the Vitamix and it'll grind up that flaxseed. It's amazing. It does a great job. And 1 ounce contains nearly 6,500 milligrams of omega-3. So that's what you want to be able to put in your smoothies. And Dr. Golder suggests that you blend a smoothie every single day. Get a Vitamix blender every single day full of the hypernourishment green smoothies. This is the book that you want to get. I'm going to send you the link to it, but it's 75% power greens, 75% power greens, and you fill water up to that level. Then it's 25%. It's going to be all your fruit, any kind of fruit you want, just to improve the flavor. And you want to be able to do that. And you've got your flax seeds or chia seeds in there, and you just let that Vitamix do its job. It's awesome, and it's great, and it's fantastic for your health. Oh, absolutely wonderful. Absolutely wonderful. So you want to hypernourish. I drink usually 3 of these a day, half a blender full every single day. So they're fantastic. All right. Principle number 6 is water, water, water. You want to make sure you get lots of water. Now, what Dr. Golder shows is that you get best results at about a gallon of water a day. Whew, gallon of water. All right, so we need a minimum of a ½ an ounce per pound of body weight a day, and optimal benefits at a gallon, which is 128 ounces a day. So you want to be able to push the water. That will make a difference. Hydration is so critical to our health. So we need to be able to do that. I'm so glad to see a doctor pushing hydration. It really makes a difference. This is my tips for being able to get 96 ounces minimum. All right, 2 full glasses in the water. Drink a glass of water before and after each meal, 2 glasses before a workout, 2 glasses after workout. So that'll get you to 96 ounces. So what this will do, it will improve the spectrum of your anti-inflammatory diet. So what we want to be able to do, if you've got kidney disease, you don't want to just go to a whole food plant-based diet. It's not necessarily anti-inflammatory. You want to get all the way to an anti-inflammatory hypernourishing protocol with high omega-3s to help you to heal from that kidney disease as much as you possibly can. That's what will help you the most. Now, you may have some detox reactions from this process. Be prepared for that. Sometimes your cells are going to release toxins, and that's normal for that to occur. So rashes, blemishes, sometimes muscle aches and pain, emotional release will occur. But you'll also have some very positive side effects. You'll weight loss, increased energy, better sleep, better mood, improved bowel function, improved bladder function. Things will work a lot better. If you're on medications, I always recommend that you not stop taking your medications that doesn't go well, or especially if you're on steroid medications. So work with your physicians to be able to taper off those medications. I am not an MD, so I'm not licensed to work with those. You need to work with somebody who actually prescribed the medications with you, but let them know about this. Remember that this is a lifestyle change. It's not about pills and a quick fix. Right? Most people don't sign up for a lifestyle change, but it's going to take that. It's going to take patience, dedication, and work. So you'll need to work at it. All of these areas are important for you to address. So I've given you a lot to be able to focus on for kidney disease. All right. So I'm going to give you this is the shortcut of practices here. Eliminate all your animal products, eliminate added oils, eliminate processed foods, hypernourish with raw plant foods, consume your omega-3s every day, drive water, 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 eliminate your alcohol, smoking, and caffeine, improve your sleep habits, reduce your stress in healthy ways, and strive for healthy relationships. I have webinars on sleep and reducing your stress and your healthy relationships as well. So make sure you check those out. Just remember this. It's all about making progress. It's not about perfection. All right. We're all human beings. None of us is perfect, perfect, perfect. All right. My mother would say otherwise, but but that's not the case. All right. So the thing is, we're all works in progress. I will always be a work in progress till the day I die. So the thing is, just keep making progress and be happy with your progress. If you make progress, you're doing great. You really are. So my final set of questions for you is, would you like to make the rest of your life the best of your life and put this into practice? Yeah, I would like to do that. So imagine for a moment, what would that look like for you if you were actually living your best life? Would you be like these people who are just vibrant and healthy and active, being able to do great things in their life and just having so much fun? Would you be dancing on the beach till the last days of your life, living a life filled with health, energy, vitality, and fun? I hope so. So the question is, where are you now? Are you there yet? Chances are you're not. So how will you get from where you are now to where you would like to be? Well, you need a plan to go from A to Z, absolutely. But do you have a plan that's actually proven to work? Most people don't. They don't. I mean, they try, they struggle, and then they fail again, and then they try again, and they fail again. And so most people don't have a proven plan. I do. I actually do have a plan, and I'm living proof because I've worked this plan for over 25 years. So 1995, I was 55 pounds heavier than you see me today. I had high blood pressure, high cholesterol, and high blood sugar, and I had issues. And then my friend walked up to me one day and said, "Getting a little chubby there, Ruben." And I had a buttermilk donut in my hand. I wanted to throw it at him, but I didn't want to waste the donut. So I got mad at him first, but then I got mad at me. And I realized I had done it to myself. So I went back to what I had learned from being an athlete and being a student, that there is a path to being able to change your life and really have it stick. So number one is I realized I had to start from within. I had to shift my mindset, my thinking, my attitude, my consciousness. And then I needed to rewire my subconscious mind, because Einstein said the significant problems we face cannot be solved at the same level of thinking we were at when we created them. Number two, I needed a proven strategy, because doing the same things over and over again, expecting different results, is the definition of, insanity. You know that. So let's not go there. So we need a proven strategy, one that's actually proven to work. Third thing is that we need to be intelligent about how we approach this. Nobody, and I mean nobody, is successful all by themselves. Nobody is. It takes a team to be successful. Coach Wooden taught me a long time ago, it takes 10 hands to make a basket. So we got to work together. We need to create a system of support and accountability so that we can be successful and we can actually be supported when we have tough times, because you know what? Tough times will happen. They will happen. That's inevitable for us as human beings. So we need that support and we need that accountability. But that's still not enough. We need to develop a track record of consistency. Consistency produces results. Now, I was a collegiate athlete. I played at a high level of basketball. I played semi-pro basketball, and I swam and I qualified for nationals. So I have a track record of understanding how this process works. But you know what? You have to apply this process. And you have to apply it in health the same way that you apply it as an athlete. It's no different. It's no different than that. So I went to work using this process, and I completely lost all my weight. I got healthy, and I've been healthy and fit ever since. And I still have to work at it. I still do. But the best thing about this is that I've been able to teach hundreds of people how to do the same thing for themselves. So that's what I'm here to do for all of you, just to share with you a couple of things of what I do, my services. I do lifestyle medicine consultations, one-on-one. I'll work with people to be able to help them to develop a plan. It's a very in-depth and comprehensive approach. I also have a group coaching program. The next one is starting this next weekend. So I'm very excited about it. It is awesome. It's an awesome approach to be able to build that support network, that group coaching, that support group, everything. And it's just amazing. So we have 2 intensive weekends where we work for 4 hours each day. And it's followed up by 12 weeks of group coaching with me. And it's fantastic. It's just awesome. And then I have a very extensive curriculum. I cover a lot of material in both weekends to set you up in your internal game and then to set you up in your health practices. One of my graduates is, I think she's on here today, and that's Donna. So this was her when she started with me in April 2018. And then she participated in my program several times, and we were able to fine tune all the little things that made a difference for her overall health. And she will tell you that she is living her best life right now. And she really is. I mean, she's out there walking. I admire her all the time. She's out there doing 10-mile walks, 11-mile walks, doing all kinds of great things. She's got this great smile. I can't wait to give Donna a hug again. All right, so I can't wait. I mean, she's just doing so awesome. I'm so proud of her. In addition, I also do programs for the workplace and organizations. So I come in and actually transform an entire organization, raising the bar on their productivity and their effectiveness. It's just awesome. And it improves the culture as well. So this is my contact information. I'm going to send it all to you so you have all that, but these are the things that I do. And then I just want to finish up with this quote before I answer questions. I'll go to the chat window in a second. But one of my favorite quotes, that life is not a journey to the grave with the intention to arrive safely in a pretty and well-preserved body, but rather to skid in broadside, thoroughly used up, totally worn out and loudly proclaiming, wow, what a ride. So I hope that you see it that way. This is how I see life. I want to go out with this kind of exclamation and loud declaration. So let's see. I will stop the sharing now and go to the chat window and look at the questions. If you want to unmute yourself, feel free to do so. Let's see, there's a whole bunch of you here today. Yeah, awesome. Okay, so let's see. Let me go back to the beginning and look at some of the questions here. All right, Donna's here, yay. Okay, new, Fatima Williams, new, yay. All right, let's see, Angela from South Beach, outstanding. All right, so question, can supplements such as chondroitin or liquid collagen affect creatinine and therefore kidney health? Maybe, I don't know, but here's the thing, that's not how we operate in lifestyle medicine. So we look at the big picture, being able to change your lifestyle. Let's look at the cause as opposed to trying to treat it with supplements, because that's going to be much more effective. Okay, why the eGFR conversion for African Americans? You know, there's all kinds of splitting hairs by these wonderful hyper analytical people. So it seems that it lessens the sense of urgency, causing one to wait because of the conversion, making it appear as though it's not as bad as it really is. I agree. So that's why we cannot rely on lab studies alone. We need to be able to look at lifestyle. Okay, so let's see. Type 1 diabetic started high quality vegan 4 weeks ago, prior kidney disease, kidney issue, creatinine, retested 4 months later, and it was normal. Yay. Since COVID, no blood draws for 16 months, new draw in a month, but doctor didn't think worth testing kidney function. Well, okay. I assume that's an error. Secondly, these concerns alarmed me about veganism, especially with gastroparesis and celiac. Separate, can someone help me figure out lab tests if any of the concerns in this article are valid? Are they valid? So what you can do, here's what I would suggest. Let's see, L. So go ahead and you can send me an email and we can talk about being able to set up a consultation to go over your blood studies. I'll be happy to do that with you. All right, so that's basically what I can do. All right, so let's see. Very good. Let's see, anyone in Los Angeles, things, no comments, okay, question. Okay, very good. Okay, comments, let's see. Let's see. Okay, some of you are having a conversation, okay, so I'm just going through all of them. All right, let's see. Are olives and avocado okay with saturated fat, peanut butter, as well as nuts and seeds mentioned above? Thought disagreement between Esselstyn and Greger and others. There is some disagreement between some, and so what I look at is the overall picture. I don't want to split hairs on certain things, but what we want to do is be able to improve the overall health. So I like what Dr. Goldner proposes as far as the hypernourishing protocol. I'm also going to send you the research studies of what she's actually done in relationship to kidney disease using the hypernourishing protocol. So the issues with olives and avocados, they do have a higher amount of saturated fat, a little bit more, but not nearly as much as meat, dairy, and eggs, not even close. All right, so there's a big difference as far as how much saturated fat that they have in the peanut butter as well as nuts and seeds. So it's a lot different. So what I recommend to people is they have those in a much smaller amount. So that's what think of it that way. So we have to look at all of this information. Let's see, Fatima, dark greens like spinach and kale, even though they say it's not good for kidney disease. Yeah, you know, it's so contrary. You know, I had a friend of mine who was on dialysis and they were telling him you can't have the dark greens and you can't have the spinach and you can't have all those things because they're concerned about specific different things. But that, as I shared with you in the research that we're looking at all of that, those concerns are really outdated. So it's not true. And Dr. Goldner's actually done work with people following this protocol on the hypernourishing protocol and has absolutely reversed kidney disease. And she published that in the International Journal of Disease Reversal. I'm going to send you the article so you can see that for yourself. All right, let's see here. Also, testing glucose blood is thin, watery after eating flax and chia, and more bruising. I don't know. Okay, I'm not sure what to do with that. All right, let's see. I have kidney disease and have been vegan for about 15 years and no oil for almost a year. Have 65% blocked carotid arteries. I did manage to get my cholesterol down, but don't know the status of my arteries recently. Should they be better? And why do I still have kidney disease? All right, so this, for you, I would consider really taking on the hypernourishing protocol. I really would like you to consider doing that, because there is, every single one of us is different in terms of how disease shows up and where it presents. So the genetics determines the location of the disease and what you're predisposed to. The lifestyle will then lead to the damage that actually gets occurred. And what happens for a lot of us, what we don't realize is that, yeah, maybe you've been vegan for about 15 years, but how long were you not vegan? All right, so that loaded up a lot of damage for a long period of time. So that in what we like, with Dr. Goldner, like when I showed that spectrum of different types of diets, you can be on a whole food plant-based diet and it's still not necessarily anti-inflammatory. So it may not be anti-inflammatory enough what you're doing. So what we need to do is think about actually pushing the anti-inflammatory levels up higher. And I would definitely strongly recommend doing the hypernourishing protocol, follow the protocol. That's why I presented it today, because I know that there are people who have a whole food plant-based diet and they still have kidney disease. And
yeah, I eat a lot of, I make a lot of Instant Pot, like chili. So I eat a lot of beans and that kind of thing, with tomatoes and other vegetables in there. So that's what I eat a lot of.
Great. Great. So how much greens are you getting?
Yeah. Okay. I'll try that.
How about flax and chia seeds? How much of that are you getting?
I do flax seeds when I have my breakfast. When I eat cereal or something, I pour a lot of flax seed on that. So I get.
So let me ask you this: are the flax seeds ground or are they whole?
They're ground and they're in the fridge.
So they're already oxidized.
Probably, yeah. If they are ground, but I keep them in the fridge. So
no, they're still oxidized. Okay, they're exposed to air. They're oxidized.
Oh, right, so they're already bad.
That means that they're oxidized. That means they're no longer as effective. Okay?
Yeah.
So they're not going to have the biological activities of the omega-3 acids that we need. So this is why the hypernourishing protocol. This is what I'm going to recommend to you, is that you really follow the hypernourishing protocol, so you can get those biologically active omega-3s, and you get the greens, and you get all of the things that you need to be able to really promote that healing for you, and that will make a really positive difference.
So yeah, I also have a whole thing of chia seeds that I haven't used, so I don't know how old they are. Are they still good?
They're good. Start using the chia seeds.
Okay, start eating the chia seeds and buy whole flax seeds and grind them up or put them in the green thing. Now,
do you have a Vitamix?
Oh yeah. Oh yeah.
Perfect. Okay, then you're set. You're set. That's all you need.
Okay. Well, send me what needs to go in there.
I'm going to send you recipes. Okay. So
you do that.
Okay. All right. Really great. Really great. All right. So let me continue. Let's see. I love the plan. However, the foods such as avocado, spinach, kale, Swiss chard are said to not be helpful, or suggested for those with kidney disease, IM stage 3. Yeah, consider from everything that I share with you today that all the previous information is debunked. it's just, it's outdated. That's why I presented all of this recent research, all of this recent information, so you really get that all of that information that they used to say the doctors were operating on previously antiquated information. So we have new information. So that's why I presented the latest, cutting edge, recent information for you to be able to have. All right, so that's why I'm saying, take this information to your doctors, because they're not up to date on this information. I promise you, they're not reading all these journals. All right, let's see what else. Let's see. Regarding oils, are nut butters okay? So here's the thing. All right, so so what happens is that we get into nut butters and then we start getting higher fat. So sometimes you can be having too much fat. So remember, if there's oil slicks inside the cells in your body, you've got kidney disease happening right now at a higher level. We want to reduce the fat for the short time being. We want to do that for a while. And we want to have the healthier fats from the omega-3s. That's what we want to be able to do. The nut butters tend to have higher omega-6s. So you want to look at that. So let's not go there. All right, so let's shrink it way down. All right, seems like, another question, seems like liver functionality can impact kidney functionality. Any thoughts? Absolutely, they go together. Yeah, because you know what? When chronic disease is happening, it affects every organ system. Remember, it's the sympathetic, parasympathetic branches of the central nervous system. So when we're in the sympathetic state, it's going to affect every organ system in the body. I'll say this over and over again. All right, every organ system in the body, every cell in your body in a particular way. So it's going to affect everything in your body, including your liver. So the liver and the kidney not being able to work together. Yeah, it's absolutely the case. Absolutely. All right, let's see here. Let me go. Anti-inflammatory. I get it. Sounds like a large portion of raw is useful and super helpful. Will you send the hypernourishing protocol? Yes, I will be sending you the hypernourishing protocol by Dr. Goldner. I will be sending you that. I recommend you get her books. Goodbye Lupus. You get the green recipe smoothie book, green smoothie recipes book. And then also get her book, Goodbye Autoimmune. I'm going to send you other information. In fact, for this webinar, I have done so much research. I mean, because I designed this one specifically for not only you, but also I want you to send this information to your doctors, okay? Because they're not up to date on this. I promise you. Did you know that the average amount of time for physicians to actually get the clinical information that's done in peer-reviewed research journals and then be able to start to implement it, you know how long it is? 12 years on average. 12 years. Now this research was this past 3 years. So I'm giving you this information to bring those doctors up to speed. So if you've got kidney disease, you need to bring them up to speed. You need to share this with them so that they know all of this, okay? So I'm going to send you, so all of you who registered, you are going to get an email. I'm going to send you the recording for today. I'm going to send you all the slides from today. I'm going to send you a ton of resource information. I'm going to send you all the literature, the literature references. I'm going to send you the links to a lot of the most recent research, all the ones that I quoted in today's slides. All of that you're going to get for free, okay? Please forward it to your doctors. All right, send them this link from today's webinar. Send it to them because they need to watch this. I love educating physicians. They're my colleagues, okay? I went to medical school too. All right, so they need to understand this because they don't get this. All right, let's see, what else? All right.
I just put a little comment about the nuts, like all nuts aren't created equally.
Correct.
And that website to look up the omega-3 to omega-6 ratio I found is really helpful.
Oh, great, yes.
Like if or when you're going to have nuts as a treat or just rarely or seldomly, you know, maybe have make your own walnut butter instead of choosing peanut butter that has a really high omega-6, so they're more inflammatory.
Yes, exactly. Very good. Thank you for that, April.
Oh, yeah.
And then a blend tech, Fatima, is definitely okay. Yeah, blend tech and Vitamix are very high grade. They're very, very high. So those are good. Those are great. Any other questions? Unmute yourself. Unmute yourself. I love answering questions. George, you don't have a question today. What's with you?
Hey there, this is Fatima.
Fatima.
So it sounds like we're staying away from nuts with the exception of some. I eat pecans and I also drink almond milk that I make myself. Is that okay?
Well, let's look at what we want to do. So what we want to do is really, really, really improve your hypernourishment. So Dr. Goldner says this, and I think it's really appropriate here. even if you don't change your diet right now, the most important thing you can do is to start to hypernourish. Start jamming these greens and your omega-3 high flaxseed or chia seeds into your body. Like, you've got to jam this in. So this is your priority. The priority is not dealing, don't focus on the nuts and everything else. It's okay if you have, here's what I say. You're going to decrease your food intake anyway, because when you put 3 of these in your body, you're not going to be hungry. I promise you. I mean, this takes up a lot of bulk, all right? So you're not going to eat as much, so you're going to just eat less. So just think about eating less, okay? Eat less of the nuts, seeds, and high-fat foods, all right? I would just eat a little bit less, have plenty of salads, have plenty of plant-based foods, but you're not going to be as hungry because you're
so with the salads, I don't have to restrict myself to just arugula then. Okay, so I can do arugula and spinach and other greens. Yeah, sounds like it. Okay,
yeah.
cool.
Yeah,
cool.
April, I have to, so April makes these salads that are amazing. I mean, it's just like, they're chopped salads with, I mean, all kinds of greens, squashes, beans, you know, all kinds of stuff. It's amazing. I mean, just knock yourself out. I mean, salad should be this cornucopia of food that's just so delicious and filled with flavor. Oh, it's a great experience to have great, healthy salads. So just knock yourself out, have all kinds of things in there.
Thank you so much. This was very, very helpful. I look forward to getting the books and hopefully learning how to make salad dressings without olive oil, because I use olive oil for a lot of salads.
Oh yeah, you're going to stop having that olive oil. That's done. Yeah, you want to stop that. So remember, the things that you want to cut out are the animal foods, all the oils, and all the processed foods. Those 3 got to go. Okay. Don't worry about the nuts so much. Just decrease them. And you want to hypernourish with raw plant food. Get your smoothies, okay? And you want to drink lots of water. So
okay, and then lastly, I'm hypernourishing, beginning with getting the book that you just mentioned by Dr. I can't remember her name. Okay, awesome.
Don't worry, I'm going to send you the email. All right, you're registered, so I got your email address. I'm going to send you all this information.
Beautiful. Have a good day. Thank you so much.
Yeah, I try to get it out tonight. That's what I'll try to do. Very good. Anyone else? Anyone else? Whew, you guys kept me for a while. This is great. I love it. Yes, George, you have a question?
Let me ask you quick. Yes, I did. In fact, I'm drinking my green smoothie right here.
Yes, George.
Yeah, and I started ever since you told us about Dr. Goldner and her protocol and stuff. I just jumped on the bandwagon. I had a quick question. I did not get her book yet. I'm about to get her book. I got Thomas Tedlock's book, which is her husband, and she's got 3 books out, and the latest one is the autoimmune one. And I was wondering if I should just get the autoimmune one because it's the latest book, or is there any significant difference between the lupus and the autoimmune one to where I should get both?
I enjoyed reading both of those books. Okay, they're really great. So the Goodbye Lupus, she expands on her story, her personal story, what she went through. And for anybody who's got any kind of autoimmune disorder, it is a wonderful book to read because you get to see how, I mean, she really had to go through a lot of tough times. She was at the age of 16, she was on chemotherapy for 2 whole years. Now that's in the Goodbye Lupus book. I mean, her life was saved by these doctors, and thankfully her grandmother was so positive that she learned about how to have a positive attitude. And that's a great book. It really is. It's a great book because it really helps you with the mindset of being able to conquer a chronic disease condition. So I love that book. The recipe book is really good too, but the Goodbye Autoimmune, she summarizes the first book and then she builds on that first book with a lot more information about how to actually take on the mindset and the lifestyle to actually conquer chronic disease. So they basically are partners as far as books. So there's not one over the other. I enjoyed reading both of those. So you will too.
Thank you. Thank you for all the research you're doing for us. I appreciate that.
Oh, you're welcome. You're welcome. When are you going to join us in our program, George?
Soon.
Soon. Okay, good. By the way, I want to let everybody here know I have already now, I've got this online program starting next weekend. It's going to be awesome. And then I've been following very closely in all the public health guidelines in regards to COVID and everything else. So it looks like by October 1st, we'll be good to go with being in person once again. And so what I have designed for the October Lifestyle Medicine Immersion Program, the Evolving Health Program, will be live and in person. It will be a lifestyle medicine retreat. Instead of the weekend, we're going to have a full week at none other than the Stanford Inn in Mendocino, overlooking the Pacific Ocean. It's going to be fabulous. This beautiful vegan resort. It's the only vegan resort in the country. And it's just fantastic. It's going to be awesome. You're going to have nothing but beautiful, fabulous food, beautiful rooms overlooking the ocean. We're going to be there from Sunday afternoon through Saturday afternoon the next week, and it's going to be absolutely fantastic. I can't wait. I'm going to be announcing it very soon. Save your pennies so you can come. It's going to be well worth it. It's going to be absolutely fantastic, and I can't wait to spend an entire week with everybody. We're going to have a great time. I can't wait to do this. So just to let you know, that's happening. So George, you got to join us there. All right, so it's limited too. I'm only going to have a few people, so I know you can be there, George. George, you would love that because it's going to be a vacation course. So first word is vacation. So it's a vacation and a course. All right, so that's what we're going to do. I can't wait. It's going to be so exciting. Okay, all right. Thank you so much to everyone. Reach out to me if you have any questions whatsoever. This is the final of my webinar series on health. I'm going to do some other webinars coming up in the summer. And then I'll come back to the health seminar probably by the end of the summer. So look for that. And it's been wonderful to spend this time with you. Thank you so much for being with me. Please, please, please share this information widely. Be sure to share this with your physicians. If you've got kidney disease, please do this. They need this information. So thanks again. Have a fabulous, fabulous day. All right, bye.
Thank you.
You're welcome.